Hi. I have a problem. I have this birth plan, and I want you and your partners to sign it.
I'm sorry. We do not sign birth plans. That is against our policy here.
That is not right. Ricky Lake says I have to have a birth plan and my doctor must sign it, or they will do stuff to me against my wishes. I have been to 17 other practices, and they will not sign it either, so I left to find a high-risk doctor.
Are you high risk?
I had late prenatal care. Because I could not find a doctor who would sign my birth plan.
We do not sign birth plans, because too many people have used them to represent a legal document, and have claimed damages, because all of the plan was not met. We can however review the plan, and see what we can agree to, and if there are things that we may have problems with.
Then you will sign it.
No, we will not sign it. We can place it in your chart, so people will know your wishes. Most of the time, however, it is not necessary because, unless it is an emergency, you will be able to tell us what your wishes are when you are in labor.
Okay. Page 1 of 22. I do not want to be induced unless absolutely necessary.
We don't induce people, unless it is necessary. We only electively induce people, if they request it, and they are term, or if there is a good reason. I will remind you of that part of the plan, when you are going into your 42nd week.
I do not want any pain medicine, unless I request it.
How would we know you need pain medicine, unless you request it? We don't give pain medicine to people, just because we feel like it.
I want to try alternative means of pain control, including heat, ice, music, distraction, yoga, breathing, aromatherapy, and wheatgrass.
Unless the music involves a marching band, none of those things are prohibited by the hospital, except open flames, since it is a hospital and there is oxygen. If you can't smoke, then candles would seem to be a bad idea too.
I want my family with me during my delivery. I want all 6 children, my in-laws, my sister and her husband, my doula, my shaman, and the entire cast of the Jersey Shore.
The hospital sets policy on who can be in a delivery, not the doctor. A birth plan will not change that. But I do not care. Build a grandstand. It is your hoo-hoo.
I want to labor and deliver in the hot tub.
We do not have a hot tub at our hospital. Unless you are bringing one from home, that will not be possible.
I heard that delivering babies into water is good for them and helps them feel better about leaving the water inside the womb.
The study that showed better neonatal outcomes with water birth was done on cats. We do not deliver cats here usually. Besides, we do not have a hot tub.
Why not?
Because this is a hospital, not a spa. We deliver sick babies and take care of sick mothers.
I want to be able to get into the hot tub even after my water breaks.
That is a bad idea, because of the risk of infection. But, once again, we do not have a hot tub.
I know that it was next on my list, on page 4. Okay. Next, I do not want an epidural.
Fine.
No one is to give me an epidural.
No one wants to give you an epidural.
I do not want anyone to give me an epidural without my permission.
No one gives anybody anything without their permission, unless they are incapacitated or not competent. That is called assault. We try not to assault our patients.
No one should try to talk me into getting an epidural.
Okay. What should we do if you are begging us for one?
Well, then I would want it.
That sounds like the definition of consent to a procedure to me. We generally do not do procedures without consent.
Next, I do not want a C-section, unless it is absolutely necessary.
We do not do C-sections, unless they are necessary. Sometimes we aren't positive it is necessary, so we may discuss it with you, especially if your labor is not progressing, or if the baby is in distress.
I do not want a C-section that is not natural.
Guess what is natural? To die in childbirth. But, Oklahoma. I will remind you of your wishes after 36 hours of labor and 4 hours of pushing.
I do not want Pitocin. I want to labor naturally.
Pitocin is natural. It is made by your body to cause contractions. Anyway, we don't routinely use Pitocin, unless we are inducing or augmenting labor. Again, we do not use anything without your consent. We don't need a birth plan to tell us not to assault the patient.
I want to hold a baby right after birth.
That is routine, unless the baby has a problem.
I need a baby next to me right away. If it has a breathing problem, being next to my skin will fix that problem. I do not want a baby taken away to a warmer. The first few seconds are too important. If I do not hold a baby, then I will never bond with it, and it will have all kinds of problems and end up on Jerry Springer, or with Dr. Drew.
Unfortunately, once the baby is born, it is a human being with rights, and may have medical needs of its own. While we feel that early contact is very important to mother and baby, if the baby is not breathing, or is in distress, it will need to be cared for by the nurse or neonatologist.
No, I do not want it taken away no matter what. That is in my birth plan. I have to bond with it.
Bonding will be less important if your baby dies, or gets brain damage from respiratory failure.
It is very important that the cord stops pulsing before you cut it.
Why?
I read that gives the baby more blood and more stem cells and more magic mommy juice and stuff, so you should not cut it until it stops pulsing.
Blood in the cord flows both ways. The pulsing in the cord also comes from the umbilical arteries, which take blood away from the baby. If the baby is on your chest, and above the level of your placenta, which you insist on having right away, won't the blood flow back into the placenta as well? What if the cord isn't long enough for the baby to get to your chest? Can we cut the cord before he leaves the hospital, or is he taking the placenta to daycare with him?
The father has to cut the cord no matter what. It is part of our religion.
There is no mainstream religion that specifies that the father cut the umbilical cord of his child. What religion are you?
Unitarians. Anyway, that is some of my birth plan. There are 12 more pages. Please read them and sign it.
Sorry, we cannot sign your birth plan. I will put it in your chart though. Then when you come in with your cord prolapse, or abruption or preeclampsia, and have to have a C-section with general anesthesia and a REN-ICU admission at 32 weeks, we can discuss why it is a bad idea to have a birth plan.